In a world where headlines often focus on conflict and crisis, something incredible happened in the heart of Africa. A U.S. general stood in silent disbelief as Captain Ibrahim Traoré, the president of Burkina Faso, handed over free, full-service mobile clinics to all 13 regions of his country. A gift to women and children in some of the most underserved areas in Africa. Not funded by foreign aid, not delivered by global NGOs, but powered by Burkina Faso's own gold. This is a story of vision, leadership, and hope. This is how Africa rises, on its own terms. This is Make Africa Great. Across the African continent, access to quality healthcare remains one of the most urgent challenges. In rural areas, where more than 60% of the population in many countries live, clinics are often under-equipped, understaffed, or completely out of reach. Expectant mothers walk miles for prenatal care, and many children are born without any medical supervision. Diseases like cervical cancer, breast cancer, and complications during childbirth are often preventable. But without early detection and treatment, they become deadly. The World Health Organization estimates that over 70% of cancer deaths in Africa are preventable, if only there were access to basic screening services. The tragedy is not a lack of knowledge or skill. Africa has brilliant doctors and nurses. It's about access, infrastructure, and political will. And that's where Captain Ibrahim Traoré stepped in with something no one expected. At just 34 years old, Captain Ibrahim Traoré became the youngest leader in the world when he took power in 2022. A former army officer, he rose in response to public frustration over insecurity and economic challenges in Burkina Faso. But what makes Traoré different isn't just his age or background, it's his vision. He believes Africa must rely on its own resources and stand proudly without waiting for approval or permission from the West. While many leaders give speeches, Traoré takes action. He speaks about sovereignty, self-reliance, and service to the people. And in July 2024, he put those beliefs into motion with one of the most ambitious health initiatives Africa has ever seen. One that's changing lives already. With the launch of free, full-service mobile clinics, Burkina Faso has taken healthcare where it's needed most, to the people. These are not just ambulances or pop-up tents. Each clinic is a fully equipped vehicle offering prenatal care, ultrasound screenings, breast and cervical cancer detection, basic emergency services, child health checks. The focus? Women and children, the backbone of every society, and too often the most neglected. The initiative was rolled out to all 13 regions of Burkina Faso, reaching remote villages where the nearest hospital is sometimes a full day's journey away. And here's what really shocked the world. These clinics were 100% free. They were not funded by outside donors. They were paid for using Burkina Faso's own gold reserves, turning natural wealth into public good. Captain Traoré's team said it clearly. We are investing our own resources in our own people. We do not need to beg for help. During a joint discussion with regional military officials, a U.S. general reportedly asked about the costs and logistics of such an ambitious program. When he learned it was funded through gold, not loans or foreign partnerships, he fell silent. According to witnesses, he was visibly stunned, not by the technology, but by the principle. This wasn't about what Burkina Faso could do. It was about what it was willing to do, without Western aid. African citizens around the continent began to share the story online. The hashtags #Captain Traoré, #Gold for Health, and #Make Africa Great began trending in Francophone and Anglophone regions alike. Influencers, journalists, and even diaspora leaders began praising the move. Commentators said things like, "This is the Africa we've been waiting for. Gold should feed our people, not sit in foreign banks. If Traoré can do it, why not other leaders?" Meanwhile, critics of Western aid models began pointing to this moment as proof that Africa doesn't need saving. It needs sovereignty. This story isn't just about clinics, it's about dignity. It's about belief in African potential. It's about a leader who used gold, the same gold often taken out of Africa, to give life back to its people. Captain Ibrahim Traoré's mobile clinics show us that true leadership is not about making speeches at summits. It's about meeting people where they are. Rural women in Burkina Faso now have access to care that will save lives. Children will grow up healthier. Communities will thrive. and a continent will watch, and perhaps follow. Because when one country stands tall, others rise too. This is more than news. This is inspiration. This is what it looks like when we choose to make Africa great, together.
Thank you, Africa, Mama Africa.